Hey guys, Sid here in the AFE Training Center. We are doing a little neurotoxin treatment on this patient today. So I'm starting by marking the patient up, marking lateral borders, and then getting good consistent coverage of that entire frontalis. Moving on to the glabella, having her scowl or make an angry face, and marking the procerus in the middle, and then the two corrugators, medial and lateral heads of those corrugators, a little brow lift there that I'm marking. And you can see I'm having her close her eyes really tight so I can see where that orbicularis oculi pulls. And then I'm marking up crow's feet. So also orbicularis oculi muscle movement, but those are those horizontal lines that come out from the lateral canthus of the eye. Moving on to nasalis, having her scrunch, and those are those cute little bunny lines that pop up on her nose, across the bridge of her nose. So marking those, and then DAO, which she is good at making these faces. Just laughing a little bit in between, which is, sometimes happens. So DAO, I'm making sure that I feel that muscle movement and having her do it a couple times to make sure I am pretty confident. And then mentalis, so having her frown, pull that bottom lip up towards the top and marking those muscle bellies of the mentalis. Masseter, this patient clenches, grinds, gets migraine. She has pretty beefy masseters. You can see my finger move as she clenches. So I'm marking superficial and deep masseters, marking anterior and posterior border, and then about a centimeter above the mandible, marking right in the meat of that muscle and double checking. Now we'll get to injecting. So I'm holding the skin taut, using a ComfortTox syringe. It's a 0.5 cc syringe. And it's multi-beveled, 8mm 31 gauge. You can see it's going in fairly easily. I'm just working my way from one side of the frontalis to the other and holding that skin taut, like I said. Having the patient turn if I need her to. Patient did really well with that. Glabella, she doesn't have a ton of movement there, but I'm going to hit her with her normal dose just because we know it works. But always assessing kind of how that muscle is moving when your patient comes back. Supporting that orbital rim and always making sure that we are in the meat of that corrugator. The frontalis runs behind each corrugator, so we don't want to go full needle depth because we run the risk of maybe hitting that frontalis with a pretty hefty dose of product, which would lead to dropped brows, which is what we're trying to avoid. No one wants that look. And moving on to crow's feet. Here I'm kind of holding the skin taut and just injecting up and away, always keeping the trajectory of my needle up and away, never kind of going down because we run the risk of hitting unintended muscles when we do that. Very superficial with those injections. Brow lift, I am just injecting right where I marked, where that orbicularis oculi pulls. We want to relax that so it stops pulling down on the brow, in turn giving a more lifted look. Here with the nasalis, this is a fairly pinchy injection, very superficial. I'm using a tight dilution here so that we don't get too much spread of the product and kind of sealing off that LLSAN so that we don't affect kind of the way her lips sit. She doesn't have a gummy smell, so we don't want to treat that. DAO, again, always double checking, injecting up and away, very superficial, and I kind of just have the patient turn towards me and almost slide in flush with the skin, so very superficial. And then having my patient, again, make the face for the mentalis movement, and I'm just kind of isolating those muscle bellies and going straight in 90 degrees. You can feel it. It kind of feels like a jelly bean or a kidney bean. Masseter, I'm going in. I am splitting it up into 2 injections here just because she has so much muscle strength there. And then I have my deep drawn up in the same syringe. I'm going straight in all the way to the hub. The Razorius attaches anteriorly and superficially on this masseter, so that's why I'm going all the way to the hub. And then deep masseter, you'll see she kind of activates my finger moves quite a bit. That's the deep muscle of the masseter. And then moving on to temporalis, I did not mark these. I kind of just separate the hair where I feel that strength and clean really well with some alcohol. Of course, always cleaning every area well with alcohol prior to treating. Here I'm treating anteriorly, giving 5 units, and then moving back and treating medially a little bit. And then other side, you can see here that I've separated the hair, injecting up and away, and making sure that I'm right in the meat of that muscle. It's a nice thick muscle. You'll slide right in. And again, here, just wiping up and away, always keeping things up and away, having our patient not touch, lay down, or sweat for 4 hours. I'm just using a makeup wipe here to wipe, and she will be on her way. Thanks for stopping by.